Welcome to our conversation titled Developing Compassionate Chatbots. In this episode, Osnat Melamed, an addiction medicine doctor from the Center for Addiction and Mental Health in Toronto, and Monica Perry, associate professor at the Bloomberg Faculty of Nursing at the University of Toronto, both AMS Healthcare Fellows in AI and Compassion, and both developers of digital tools, discuss their use of chatbots in compassionate healthcare.
My name is Osnat Melamed. I am an addiction medicine doctor, family medicine by background, working at the Center for Addiction and Mental Health in Toronto. I'm also an assistant professor at the Department of Family and Community Medicine at the University of Toronto. And very excited, as I said, to be here today.
My name is Monica Perry, and I am an AMS Healthcare Fellow. And I'm also an associate professor at the Bloomberg Faculty of Nursing at the University of Toronto. I'm also a nurse practitioner in the cardiac program at Kingston Health Sciences Center. And I'll share a little bit about my program of research, and then I'll sort of pass back to you, Osnat, to share a little bit about your program of research. So my program of research is really focused on reducing the burden of cardiovascular disease and its complications. I'm also interested in patient-oriented research and sex and gender influences on health and well-being, which will tie into some of our discussion, I think, during the podcast. I am currently leading a team of researchers to develop and test @Heart. And @Heart is a tailored digital health innovation for women with heart disease. And the chatbot that we'll talk about today, the chatbot I'm using, is embedded in @Heart. So Osnat, I'm interested in your program of research.
Thanks, Monica. That's very good to hear about the work that you do. And I feel that we have a lot of intersections between our work because my focus of research is developing digital health tools for people who have addiction and mental health problems, or improving the treatments for those conditions. And a big part of what I do is focus on tobacco addiction, and the link between tobacco addiction and cardiovascular disease has been, known for many, many years. So I think together what we are trying to do is prevent chronic disease, and when it happens, reducing the burden of it. So I see a lot of similarities between the work that we do. I think specifically being an AMS fellow in compassion, I think that what has brought me to focus more on compassion in the work that we do is I have two hats that I carry. So the first one is being a physician working with patients who have tobacco addiction or other addictions to other substances. And the other one is being a researcher. And during my clinical work, I would say that when you work with people with addictions, so very early on in my training, I was introduced to motivational interviewing, which is a type of psychological intervention in which we approach people who come to us and try to understand their story, try to, by active listening, eliciting what is important for them, what are they seeing as priorities for their treatment, and also eliciting motivation that they have to change. And it's usually by this collaborative interaction with patients that we can best support them into reaching, a healthier life. And I think that the very much basis of the motivational interviewing is embedded in compassion. We are empathetic to our patients. We listen to them. We try to understand what's most important for them. And we also have this non-judgmental approach as opposed to perhaps, previous communication styles of healthcare providers. We are taking a collaborative stance, which is non-judgmental. And this part of the compassion, the motivational interviewing techniques that we use, this is part of the transition that we're trying to bring into digital health tools. So it can be quite a challenge, right? Taking a human provider that can be compassionate. And we have certain strategies and techniques, such as motivational interviewing, that can help a person or provider be compassionate. And automating this, putting this in a chatbot, and we'll get to our projects very soon. But this has been an exciting intersection between, the clinical work that I do and the research, and putting compassion at the forefront has been a very exciting point in the work and the research that I do.
I wonder if I could, do you mind, Osnat, if I just pull apart the compassion piece a little bit? I'm interested in compassion, and you are too. And I want to just sort of pull away a little bit and talk a little bit about compassion, but then I want to come back and ask you a little bit about some of the components of compassion, because I'm interested in sort of how you sort of enact these, especially the power part of compassion. So for me as a nurse, my background's in nursing, we have a practice standard in nursing that discusses a therapeutic nurse-client relationship, which is usually a face-to-face relationship, sort of pulled away from that digital health technology piece. And according to this, there are sort of 5 nurse-client relationship pieces. Trust. So I'm going to sort of come back at you in a minute and ask you how you establish those trusting relationships through digital technologies with your patient population. Respect. So respect is sort of the dignity, the work, and the uniqueness that each individual brings to that. For me, the nurse-client interaction, or for you, the physician-client interaction. The professional intimacy, and that is more around sort of the social, psychological, and as a nurse, sort of the physical aspects of providing care. Empathy, which you already mentioned. And then the other important piece I'd like to explore a bit with you is that power dynamic, because certainly there's that unequal power. And how do you, in my mind, I have a little bit of difficulty. How can you sort of level the playing field through digital health technologies and level that power relationship, which I think is really integral to developing that trusting relationship. So maybe you can sort of just speak a little bit about that power dynamic and the trust and the work that you do.
Well, Monica, I think that this is an excellent question, really, to dive into the elements of compassion and how can we integrate them into the digital health tools that we are developing. And I think, you very nicely mentioned that compassion has a few attributes, right? And we can talk about each attribute in and on its own. So I think a big part of this process of developing a chatbot and looking at compassion is looking at the team members that I'm working with. And I do want to say that I do have a supervisor, Dr. Peter Selby, who is also a tobacco addiction specialist and an expert in motivational interviewing. And our collaboration extends to colleagues at the University of Toronto. We're working with Dr. Jonathan Rose, who is an electrical and computer engineer, who is responsible, I would say, for the engine of the chatbot, making sure that the software works. And we do have another key member of our team is Dr. Matt Rattow, which is with the Faculty of Information. And Dr. Rattow, his entire career is focused on human-machine interactions. And exactly the point that you alluded to, how can we build trust? How can we have a person? We know a little bit about interpersonal trust, right? How people trust other people. We kind of have an understanding from humanities, from social sciences, what helps us trust another person. But how can we sort of transfer this trust? Can we transfer the same elements of trust that exist between humans? Can we transfer them into a computer human interaction, right? Part of making sure that we are going in the right direction is by having a multidisciplinary team, having a lot of team members that have experience and expertise in these areas. I think a very interesting thing that you mentioned about trust is that trust is built on different levels, right? There is the interpersonal trust. So I kind of know who the person, for example, when I meet a physician, there is this sort of, physician is trained or a nurse, they're trained, they have certain qualifications. That gives me as a person coming to a provider that I don't know, I kind of have some trust in the system, right? That has trained this individual. But what do I know about a chatbot or a digital health tool, right? What are the credentials? Where did this chatbot, did it go to nursing school, to medical school? It gives a bit of, can I trust this? So one of the ways, for example, to increase trust is being transparent about who programmed this chatbot. So one of the things in our introduction, for example, we are saying, this is a chatbot that has been developed by researchers, clinicians with the University of Toronto Center for Addiction and Mental Health. So we do want to provide that information to increase that trust, so a person can know that this is not a commercial, perhaps with for-profit ambitions. This is something that has been developed by clinicians in order to improve, in my case, in my chatbot, people's motivation for smoking cessation. That's one aspect of how we can improve trust by just providing that information. Another component is, how reliable can this chatbot be? And one of the things that we are working on is, if a chatbot will say, and this is also borrowed from trust between humans, right? If a person kind of changes their mind frequently, we don't feel that we can trust. We want to have some consistency to have a reliable interaction. So of course, that's something, again, that when we are planning or designing a chatbot, we want to make sure that the chatbot is consistent. Another thing, if we want to talk about compassion, is how much can a chatbot, in interaction with a chatbot, how much the chatbot can sort of take a collaborative stance, can be interested in the other person, can have curiosity in what's happening to the other person. So those are all elements that are very important, and it's a challenge. Again, we're talking about human traits. How can we, kind of put them on a chatbot? I'm happy to later on we'll talk a little bit about how we developed a chatbot and how we can potentially those elements of compassion, how are we trying to kind of put them inside the chatbot? But I agree, Monica, that it's a challenge. I think that one of the things that, we also wanted to talk about is, compassion is a trait we're trying to perhaps, incorporate it in technology, but maybe we can talk a little bit about why we kind of, in the area of chatbots, what are, maybe explain to our audience what chatbots are, and why do we see them more and more in healthcare today? They probably have they can serve a good purpose. So just, wanted to ask you what your thoughts are about chatbots as digital health tools. Why are there, why are you interested in them? What are the utilities you see in your area of practice and research?
Yeah, that's a good question. Thanks for that question. And thanks for the information sort of around compassion and sort of the considerations in embedding that in digital technologies. So for me, my interest is in women and with cardiac disease. And we developed a simple interactive chatbot. And this really came out of previous research. We did a systematic review. It was an integrated systematic review to look at self-management programs for women and how could we improve cardiac pain and symptom outcomes for women. And there were a couple things that came out of our review. And one was women-only interventions actually could improve outcomes for women. So not interventions that were made for both men and women, but really targeted for women. And the other real key piece was support from a healthcare provider. So our chatbot is really, and our chatbot is called Holly, is really that support from a healthcare provider. And when we were testing the chatbot in its early development, I remember clearly an internal medicine physician in Calgary wondered if this was a real person or not. So I don't know if that says something about sort of the compassion piece or not, but we did exactly what you mentioned, and we put in the web app who chatbot Holly was to make it clear that this was not a real person. It was... So now to answer your question about what a chatbot is, I think chatbots have been called different things. Chatbots are bots, robots, digital assistants, artificial intelligent care providers, simulated care providers, avatars. These are all conversational agents, and they're used to either through voice or text to help establish and maintain a relationship between people. usually a healthcare provider and a care recipient. They've been used a lot in customer service. We see them a lot when we're ordering things online. The little chatbot person pops up in the corner, but they have moved into education and they have moved into healthcare. And, I think that there is a projection that these chatbots will increase. And I think we've seen a big increase during COVID-19 when we've had to sort of move a lot of our interactions, our assessments of patients into that virtual care environment. Now, most of those interactions are person to person, but it is still, how do you maintain that or establish that compassion in a virtual care environment? Now we're sort of pushing it a little bit using a virtual care environment or a digital environment, but also a chatbot, which is really a simulated person, if you will, to establish and maintain that relationship. These go back to mid-1960s with ELIZA. So we've really progressed a lot in terms of, I'm interested in your work because you're sort of pushing it into natural language processing, and our chatbot is very rules-based and not really pushed into that natural language processing bit. So I'm interested when we have our conversations later on about what specifics we are doing. How can we sort of look at those differences and what do those differences mean? I've done a little bit of a search for this fellowship in terms of how chatbots have been used in cardiovascular care, mostly used in heart failure, atrial fibrillation, and really just pushing into those components of natural language processing. They've been used to encourage patients, for example, in cardiac rehab. They have used robots, they've called them robots, to actually take information when patients are on a treadmill, and the robot then sort of provides encouragement to the participant. So if they're doing well, they'll say, "You're doing well, keep going." Or if something highlights with their vital signs, the robot will say, "It looks like you're struggling a bit. Is everything okay?" So that's sort of where we're at in terms of cardiovascular research and chatbots or robots. I'm interested in sort of the psychological realm where chatbots are used. Part of my compassion model was using the WeBot model, which is sort of into the mental health component. Not so much addictions, but depression.
Please check out the new AMS Healthcare series, produced in partnership with Healthy Debate, focusing on solutions-based articles, examining gaps in our healthcare system. We hope the series fosters an open-ended discussion on how lessons learned can enhance the delivery of high-quality, compassionate care. Go to healthydebate.ca. And now back to our conversation.
So I think, Monica, this is, very interesting to talk a little bit about chatbots, specific chatbots. But I think, additionally, we can, share with our audience that, like you mentioned, right, chatbots are gaining popularity, especially, throughout COVID. And for those who are less familiar with chatbots, I always say, you can think about just the chat in your smartphone. If it's the text messages that you're sharing with your family or your friends through WhatsApp or Facebook Messenger. So chatbots, in a sense, are just a text-based interaction, right? That we have people or users chatting with the software. Because this is a way of communication and kind of sharing information, this is exactly what you said, Monica. It's gained popularity because it's an interactive way. So instead of just searching Google, COVID vaccines, maybe I could use a chatbot. And in fact, the WHO has partnered with WhatsApp during the COVID early days of the COVID-19 pandemic in order to give people more information about the safety of vaccines. We all know that there's been a lot of concern about lack of long-term studies, and people were concerned. So we can use this as an intervention, right? We can just give people information that's through text, and it's interactive, so I can ask, and the chatbot will give me the answers that I'm looking for. And we talked about that element of trust before, right? If I know that this chatbot is endorsed by the WHO, the World Health Organization, perhaps I'm more likely to believe what it says, where it's just, some random web page that I'm reading. So there's an element of trust in who stands behind the chatbot. So I think that's important. So we're talking about being able to share information and converse with a user on the other end, and we're programming the software in this digital health tools. And Monica, with your permission, I'd like to share that, we have kind of mentioned, we have different sort of softwares that operate the chatbots. So I think the first one that's very easy to understand is a rule-based chatbot, which is called also a simple chatbot. And if you need to kind of, just to understand a bit more, you can take an example. If I want to order a pizza, then I can call the person over the phone. And I can do this with a chatbot. And if it's a rule-based chatbot, that could, work well. So for example, the chatbot would say, okay, which kind of crust do you want? Then the regular or the thick crust. So I can only have 3 options to choose from. So I can put in what I want. Then what toppings? Again, I have a fixed menu of toppings that I can put on my pizza, and that's what the chatbot will give me. And later on, if I want any drinks, again, a fixed, I can't order a drink that's not on the menu. And the payment, right? What payment option? So the chatbot could take my pizza order quite nicely with a rule-based. So I'm programming all the options that are available, and that's pretty much, what I can get from this chatbot. Monica, you mentioned, a lot of companies do use chatbots today for the same reason. I think part of the work that's been happening in the digital health realm is, can we move into smart chatbots, which are also called artificial intelligence-based chatbots. So in this case, they're not rule-based, or some of it does have a rule-based, but they can also get information in a free text form. So, for example, I can, as a chatbot, it can put in, how are you feeling today? And the person can answer a wide array of answers, right? It's not just limited to a certain number of responses, but the user can really put in a lot of things. Similarly, the chatbot, once it gets that input from the chat, once we get more interaction, the chatbot can answer freely and try to understand emotions or sentiments or where the person is at. And you mentioned, Monica, the WooBot. The WooBot has quite a lot of sort of this free text interaction, which is based on natural language processing software, in which computers are taught to understand, recognize emotions, sentiments. If a person, for example, is depressed, I can pick up on that and provide some encouragement. So this is sort of where we're at now. We're trying to advance the software of the chatbots in order for it potentially to mimic a healthcare provider. Monica, you mentioned that we're seeing it in the mental health realm, right? And perhaps addiction. And the WooBot is about helping people improve their mood, depression, anxiety. Part of the reason that we're moving into this realm is that we know that there's a great demand for support in healthcare, right? This could be for mental health conditions, that have exacerbated during COVID. Or Monica, just like your project is, we need more support for women when they are, having symptoms. And again, these are gender-related issues. So if we provide that support, that understanding, what constitutes chest pain, what to do next. This support is an extension of a healthcare provider that perhaps I don't have so many nurses, doctors, other healthcare providers that can support this person as they're having, these symptoms, but a chatbot that's always there could provide readily available solution. So I think that's part of why we're seeing more and more chatbots in healthcare today. I think both the project that I'm working on, which is developing a chatbot to help people, gain motivation for quitting smoking or improve their motivation. And also, Monica, your project of a chatbot to support women, as they're having symptoms, educate about heart disease and where to turn to if I have those symptoms. I think we are using this because we realize that there are not enough healthcare providers, right, to provide that support. Healthcare providers perhaps are not available later in the night when I'm feeling those things. So just having something with me at all times could, I wouldn't say replace, but I would say complement the existing healthcare providers and supports that people have.
Yeah, some good points. The chatbots now, you can actually help chatbots or give chatbots a personality. So the personality could be more professional or a witty sort of personality. So those are some of the things that I'm particularly interested in. Another sort of feature of chatbots is they can actually go and search the library system. For me and my work that I'm doing and the work that our team is doing, that's important. We have designed this web app, and there's some core features. One is a heart check. And so when the woman signs into the heart check, and one of the things with women with heart disease is, and I think this is a very gendered piece, is that we don't recognize our symptoms, or if we do recognize our symptoms, we delay seeking appropriate care. And part of that is we have other caregiving roles. You know, you mentioned you were a mother, so, you know, you just can't go off and perhaps take yourself to the emergency room for assessment. So this chatbot helps the women when she signs in. If she's having chest pain, we have back, and ours is very algorithmic based. When the woman first signs in, she establishes the initial algorithm, and then on subsequent sign-ins, the chatbot compares her sign-in or that algorithm to the initial algorithm. And if they match, our chatbot actually suggests to the woman, if she's having symptoms, that she has three choices. If the symptoms are within the last 24 hours, the chatbot will push the woman or suggest to the woman she call a family member, let her know she's having chest pain, and it will suggest that she could call 911 and go to the emergency room for assessment. If the symptoms have been within the 24 to 7 days, the chatbot will suggest the woman go and see her family physician to let him or her know. If she's not having any symptoms, the chatbot lets the woman go into the web app. The web app also has a library, but it's a defined library that we've established. And it would be really nice to have a system where a woman could sign in and say, you know, I'd like to know more about heart failure. And the chatbot can actually then go and search the library system and bring forward information for the woman. So there is much more breadth, I think, than that I'd like to learn about in terms of technology, rather than it being defined on what I think as a healthcare provider is appropriate for the woman. Maybe she would like to know something that I haven't thought to put into the web app. So I think that's an interesting part of the technology, is sort of a much broader sort of scope than we currently have.
You know, when we're thinking about, spread and scale, what are some of the next steps, once we've developed the chatbots that we're working on, what are some of the next steps that we're looking to see? Specifically with the chatbot that I've been working on, that is a smart chatbot, able to converse in a free form, and with the aim of motivating people, very compassionate discussion, motivating people to think about quitting smoking. And I think once that chatbot has been developed and tested, I think that one of the things that could be very exciting is to see it used in multiple places. So for example, people could come into their family doctor's office and see a QR code. One of the providers will say, okay, you're smoking. Would you like to chat with this chatbot? And they can kind of start the conversation right then and there. It could also be advertised, right? If it's on bus stops, collaboration with public health organizations. It can be very much intertwined with preventative care that's being delivered currently. And also, if it's advertised on social media and other platforms, I think it can have quite a significant impact in reaching a lot of people. Like we talked before, chatbots are really versatile. I think that some of the work that we'll look into doing is adapting the chatbot. Right now, we have a generic sort of for every population, for the general population. But I think what Monica is doing is already specializing a chatbot targeted to focus on gendered influences that affect seeking care for cardiovascular disease. So I think very similarly, once we have developed a prototype of a chatbot, we could later ask special population groups, if it's women, if it's indigenous individuals, if it's people who have mental health or addiction conditions, people from a lower socioeconomic background, we could work together with specialized populations to adapt it, to ask them what they see as most helpful. And this could, of course, increase its acceptability. So I think those are some of the things that currently we have in mind, when we talk about spreading and also making future adaptations. And I think this is, and Monica, you probably would agree with me, that this is probably the most exciting part of digital health tools, that they are very much adaptable. They can be co-designed easily to incorporate certain aspects that are specific for certain individuals. That's a leap forward when we talk about personalized medicine.
Yeah, those are some really good points. I know in my mind, I thought about sort of the reach in terms of accessibility for these digital, for example, the web app that I'm using. Now, even those technologies have progressed, and no pun intended, it is a progressive web app, which means it's available on multiple platforms, which is a bit different than iOS or Android devices, a little bit cheaper to maintain. So I think accessibility has been considered there in terms of reach. Some of the work I've done in terms of systematic review shows that people with high school education, only high school education, so you don't have to have a high education level to be interacting and using chatbot technologies. I do have some worries around other ethnic or racial populations and sort of what we know so far in terms of AI technologies. So I think we have some room to move in terms of learning about other populations. Even these technologies used in women, I mean, so far we're running a pilot randomized control trial right now to assess the feasibility of using the web app and this chatbot. So we'll know soon how feasible that is, but it seems that the technologies are working. Certainly in the CV realm, about 30% of the participants have been women, so a lower number of women. So I think we'll learn more about that. Now, something that I want to sort of pull from what you said, Osnet, is sort of where these chatbots could be. I see our chatbot, Holly, being embedded in our web app, but I also see chatbot Holly, if you can personalize Holly, being sort of on the Heart and Stroke website and perhaps at the Canadian Women's Heart Health Alliance. So she could be, or the chatbot could be a link, much like the QR code, where you could link from those more general websites into an intervention that could help improve women's health and well-being or reduce or improve smoking outcomes for people. So I think the personalization and the marketing of the chatbot, I think, is interesting. Osnet, I've really enjoyed our conversation today, and I look forward to having future conversations as we sort of evolve our chatbots through our AMS Healthcare Fellowships over the course of this year. So thank you.
Yeah, same here, Monica. It's been a pleasure to have this chat with you this morning, and same here, very much excited about the work that we do with the AMS Healthcare, with our fellowships, and I very much look forward to working together with you on future projects.
Thanks for joining us for this fascinating discussion on the use of chatbots in trusting compassionate digital care. And a big thanks to Osnet and Monica for their thoughtful insight. Please join us again for our next AMS Healthcare conversation on good tech, compassionate healthcare.
Bloomberg Faculty